Good afternoon, everyone, and welcome to today's Elsevier Live. Thanks for joining us. This session today will be 30 minutes long and will take the form of a Q&A. So just to let you know, there is a Q&A box at the bottom of your screen, and please do start to drop your questions in for Niall as we go through the session. You may have noticed, some of you, that on the 10th of October, it was World Mental Health Day. And this year, that really seems particularly poignant and necessary as the situation we find ourselves in with so much uncertainty, I think it's fair to say, has put a strain on many people's mental health. It's really important that we're aware of and learn how to talk about our mental health, which is why I'm really delighted to introduce today's session, How to Look After Yourself and Your Friends in Your First Year, and today's speaker, Dr. Niall Boyce. Dr. Boyce joined the Lancet as senior editor in 2010 and is also the founding editor of the Lancet Psychiatry, which is a monthly journal devoted to mental health. Niall trained at Oxford University and then subsequently on the University College London psychiatry rotation. His interests include suicide research, trauma, old age psychiatry, and social and transcultural aspects of mental health. So I guess it just leaves me really to put you in the very capable hands of Dr. Boyce. Niall, if I may hand over to you.
Thank you very much, Deborah. So thank you very much for joining this session wherever you are. As Deborah mentioned, my name's Niall Boyce and I'm the editor of the Lancet Psychiatry. This is a specialty journal from the very famous, very well-established Lancet group, which has been around. The Lancet itself has been around for about 200 years. Lancet Psychiatry is slightly less time, around 6 years. Our area is mental health in all of its forms. Before I did this, before I became a journal editor, as Deborah said, I was in practice for some years as a psychiatrist. This means that I went to medical school, and after my junior doctor jobs, I decided to specialize in mental health. Now, my specialism was old age psychiatry, so probably at the opposite end of the spectrum to most of you. But my training did include some work at a university mental health service. Now, in those days, they hadn't quite developed to the scale that they have now. But I have seen a fair range of the problems that people have when they start college in their first year. And of course, many years ago, I was at college myself. Now, lots has changed since then, not least the situation with the current pandemic. But I think some things stay the same. And the passage of time, of a few decades, has given me a perspective on how difficult as well as how enjoyable moving from the school and the home environment to a university environment can be. I don't want to be too gloomy. University can really be a great experience. You have the opportunity to focus exclusively on a subject that you love. You meet new people, you form friendships, you form relationships which can last for the rest of your life. But it can also be quite disorientating. One of the biggest challenges actually in your adult life, when you move from the family settings and the social settings which have grown around you and you've grown in them, and you find yourself in a very different place often, geographically and of course socially. So it's an environment you're not used to. There's the sorts of worries you might not have had before in your life, including financial worries. It could even be the case that you find the course you've chosen to do is not what you expect, and that creates, various issues as to whether you're going down the right path. So this can all provoke complex feelings, anxious feelings. What I'm going to do today is focus on figuring out whether you or your friends might need a bit of extra help to get by and to make the very most and the best of your time at university. I'm going to be talking mainly about depression because this is the most common thing that is experienced. But of course, in psychiatry, things are never quite clear-cut. That's one of its problems and also one of the joys of psychiatry. Now, psychiatry, to diagnose what we call mental illness, uses various diagnostic criteria and cutoff thresholds. And these can be quite useful, but they're not the be-all and end-all of mental health. Even if you're not experiencing something which would tick all of the boxes and be diagnosable as depression, that doesn't mean it's not a good idea to look after yourself. And as we'll discover, some of the techniques that can help with depression are also just good practice for your mental health in general. Having said that, I think it's useful if I just set out very clearly what I'm talking about when I use the term depression. And when I use this term as a clinical term, there are two things which I'm thinking of. The first thing I'm thinking of is the kind of experience that people have, the sorts of thoughts they have. The second thing which I'm thinking of is the severity of these thoughts and these behaviors and the duration. So if I saw someone in a student mental health service or in any other setting for that matter, and I was worried that they might have depression, I'd want to really explore their thoughts and their feelings in a few different areas. I'd want to know if they were feeling low in their mood. That kind of goes without saying. But I'd also want to ask about something which psychiatrists call anhedonia. That's a lack of interest and pleasure taken in activities which you normally used to find fun. Also, people report a loss of energy. They report they're tired a lot of the time. And I'd also want to know, as I mentioned, how severe this was and how long it had gone on for. The rule of thumb in most diagnostic manuals is around 2 weeks duration, although in practice, by the time that people come to see a GP or a psychiatrist, it's normally been going on rather longer than that. So if I'm getting the sense that there are these three headline things going on, which is low mood, loss of pleasure, anhedonia, low energy, tiredness, I then want to go into some of the other things which people with depression can experience. And these can often affect the body. So people find that they lose their appetite, or conversely, that they're eating more than usual. Sleep is a big issue. I found a lot of the time people report that they have trouble getting off to sleep. And that's often the case when people have anxiety and other worries. And often you also find that people will wake up early in the morning, in the small hours, and find themselves unable to get back to sleep. People will also report that their thoughts are moving slower than usual, that they have more difficulty putting things together in the way they normally would. So often I found that people with depression who are at university or in an educational setting, you'd notice that their grades were beginning to go off, to be below what you'd normally expect. The other thing is, of course, that people can feel quite irritable. So it's not just about feeling low and sad. People can often feel that the people are picking on them, that they're having a hard time. Anecdotally, I found that this seemed to be something which young men tended to present with in terms of depression. Now, sometimes these thoughts, these rather dismal thoughts that the future isn't looking good, that one is worthless, that you don't really have it together in life, these can take a very low turn indeed, can take a very negative turn, and people can be troubled by thoughts, by visual imagery, by other ideas of harming themselves or even of ending their lives. Now, these thoughts aren't uncommon. Plenty of people have them, but they're always to be taken seriously. And in some cases, when people have advanced to planning stages and so on, you do get more concerned about risk. Now, you can, if you are worried about your own thoughts or feelings or somebody else's, there is an online questionnaire which you can do. And I'm just going to pop the link in the chat box now. And this is one which the NHS has provided on its website. Now, it's not a diagnostic tool as such, but what it is a very useful sort of first glance at how things are doing and how you can then orientate where you are, what your thoughts and feelings are, and whether or not you might need to seek further help. There, I've just realized that didn't show up, so I'm going to post it again. There we go. So that should be showing up for all of you now. So do click on that if you think it would be useful. Now, of course, all these things I've talked about, these thoughts and feelings, don't happen in a bubble. They don't happen in isolation. They're in the context of someone's life. You will often find them occurring on their own or in combinations in people who've experienced big life events, for instance, bereavement. And in these cases, things very often resolve of their own accord. But regardless of this, there are things which you can do to help low mood, whatever the cause is, and there's helpful advice you can give other people. Now, as a psychiatrist, of course, I'm used to hearing all sorts of complex psychological formulations, but while I wouldn't dismiss this approach, a lot of the helpful things you can do are immensely simple and immensely practical. And one of the main things is to just look after yourself physically. So make sure you're eating well, make sure you're sleeping enough, very important sleep. And also at university, you've got to be very careful with alcohol. I think that often when people are in new social situations and have a bit of social anxiety, it can be tempting to sort of use alcohol to deal with that. They're often encouraged to use alcohol to deal with that. Take it from me, it doesn't work. Never does. And in fact, it makes the situation worse. Alcohol, besides being an addictive substance, is also a depressant for mood. And in many cases of low mood, actually just simply cutting down alcohol or stopping alcohol can have a really good effect. There's a particularly good book on this by an author called Kath Gray called The Unexpected Joy of Being Sober. And I'd recommend you have a read of that if you're interested in her experiences and the subject in general. Now, if you do need help, there are several places that you can go. And even if you don't, your friends might. So it's worth knowing about the options. Now, there are, first of all, helplines. So in the UK and Ireland, there is Samaritans, which has been going for many, many years now. In the US, there's a service called Lifeline. By and large, helplines will be there to listen, not to direct you or to give advice, but sometimes people find that simply having someone to listen to them is a very useful thing in itself. I mentioned earlier university mental health services, which are now of a scale and sophistication which would have been unimaginable 15 or 20 years ago. You can also go to your general practitioner if you have one. If you're in England, you can actually self-refer for psychological therapies through a system called IAPT, which is Improving Access to Psychological Therapies. And again, the NHS is a very useful website, which I've just popped in the chat. And if you have a look there, they can direct you to self-refer to a service near you. If you're in crisis, you can, of course, dial your local crisis line if you have one. So there's NHS 111 in the UK. In really acute situations, a lot of hospitals, major hospitals certainly, will have a psychiatric liaison service in the accident and emergency department, or the emergency room, as some people call it. The main point that I'm making here is that there are plenty of options and you're not alone. And while we're speaking of plenty of options, I'm also going to very briefly mention treatments. There are plenty of things that can be done for depression. It is an eminently treatable condition. We've talked about the lifestyle measures. Psychological therapies are very helpful. The one which is most commonly used these days is called cognitive behavioral therapy, which is a sort of short form talking therapy, which takes apart your thoughts and your behaviors and your actions and looks for unhelpful patterns and sees how you can modify them in more helpful ways. It's very practical. There are also, as I'm sure you're aware of, antidepressant medication that can be helpful, I think, in people who have more severe and more prolonged depression. They take a while to work. You don't take one pill and you feel better. They can take a few weeks, and you need to be quite consistent with the dose. If you have any questions about that, I can, of course, go into more detail in the Q&A. But the point I'm making is that there are options. Sometimes people have to try more than one thing before they find something that suits them, but there are a lot of ways in which depression can be managed, can be treated, and need not affect your life. So I'm just going to quickly, before the Q&A, mention that 2021, next year, marks the 400th anniversary of the publication of what is, to my mind, one of the greatest books ever published on the subject of mental health. I'm talking, of course, about a book by Robert Burton, who was an Englishman who wrote a book called The Anatomy of Melancholy. It's not only one of the greatest books in medical history, it's also one of the longest. But luckily, Burton summarized his advice on this thing he called melancholy, what we might call low mood or depression these days. He summarized it very nicely. What he said was that the best way to avoid melancholy was to be neither solitary nor idle. Now, to put it in slightly less judgmental 21st century terms, what this means is the best way to look after your mental health is to build a good social network, to hold on to your friends, to get their support and to support them in turn, and to keep yourself physically and mentally active. So after 400 years of progress, I think that Burton still gives the best advice on mental health. Well, thanks very much for listening. I'm now happy to take any questions that you might have.
Thanks, Niall. That was brilliant. Loads of really positive advice there for students, and also talking about the common symptoms and some treatments. And I'm sure that we're going to have some more questions on that going forward. We have got some questions in the Q&A
Okay.
box, quite a few actually. So I'm just going to, I won't take them in any particular order. Well, maybe I'll start with first. So this kind of first question calls back to the fact that we are in very unusual times at the moment, and things are very different. So the question is, during these uncertain times, many of the courses offered are being held online. It can be stressful to stay at home, especially when you have a big family. What do you recommend doing to help stay positive and focused?
Okay, well, I think the first thing is that it's important to have a division between work and not work, and that can be very hard at home. I think that's something which people have found very hard working from home, and I think it's very hard studying from home as well. So it's important, if you possibly can, to have a dedicated space that you go to clock in and clock out, to say you're going to do this work now, you're going to stop at a certain time as well. The usual boundaries which would occur don't exist, so you've got to make them for yourself, and you've got to stick to them. That's important. The second thing is, it is difficult, I know, because part of the point of university education is not so much that you sit there and hear the sort of great wisdom of your professors, though I'm sure they're very wise, but it's also that you learn from each other. And a lot of universities are facilitating social events, online events, ways in which you can get to know your fellow students and to build those friendships. And I strongly recommend that you do that. It's not a substitute for getting to see people in person, I know, but it is important that you build those networks, because hopefully sooner or later, people will be back, you will be back in university in 3 dimensions. And it's important to just form some social connections for then with people who are going through what you're going through. So those would be my main pieces of advice.
Thanks, Niall. Just on that subject, talking about meeting people online and things being quite different in terms of, not getting to know each other face to face. Are there ways of spotting signs of possible problems with people when you aren't actually seeing them face to face? You might be interacting with your cohort just like we are right now.
It is very difficult compared to seeing someone face to face. I mean, my experience of seeing people who have depression and anxiety is that a lot of it is in reading body language, that you do spot that people are almost in on themselves, that they're not making eye contact. You notice they're not as voluble, people don't speak as much, not as reactive. And, you could often get the measure of that. Of course, being on Zoom makes everyone communicate a bit differently.
Yes.
But in general, it would be people who are, not engaging. Maybe you would spot a change in behavior. As I say, sometimes it can be that difficulty in actually engaging with the course. Now, so people's grades begin to go off, people who you've noticed are previously, very enthusiastic, that diminishes. Now, I think the difficult thing is maybe not so much spotting that, which, as initiating the conversation about it, because spotting it is always a bit of an uncertain art, but it's talking to people. And
Yeah.
what I'd always advise is just asking what in medical jargon is very open questions. So rather than saying to someone, are you depressed? Are you sleeping, eating, etc., just starting off with very general questions about how you're feeling. Disclosing how you're feeling can often be a very good way to elicit that from somebody else. And in general, my experience is that people are better at talking about mental health now. The main reason that people don't initiate conversations is because they're sort of afraid of saying the wrong thing. But as long as you respond to the person, you ask open questions, you emphasize that you're basically there to just listen to them, rather than jumping in with solutions, people will tend to disclose things. The other thing to say on that, before we move on to the next question, is a lot of people get worried about talking about self-harm and talking about suicidal thoughts. And a lot of people are worried about talking to their friends about this because they say, oh, if I ask my friend if they've thought of this, maybe I'll put the idea in their head. That's not how it works. In general, you can ask about these things sympathetically. The way I'd normally do it would be that I'd say to someone, sometimes when people are feeling quite down, they can have thoughts which worry them. And sometimes those thoughts can even be about harming themselves or worse. I wonder if you've ever been troubled by any thoughts like that or had any thoughts like that. And if you introduce things in that tactful way, people can disclose things. You won't put the idea in their head, you won't make them harm themselves, but you will maybe help them to open up and go on the first stage towards getting the help which they need.
Thanks, Niall. I think that's really helpful advice for people on the line there. Just a slightly different tact, but actually something that you've touched upon already, and something that we were talking about just before we came online.
Okay.
Is 4 hours sleep good enough in medical school? Is the next question.
Okay. Well, there are some people who can manage on 4 hours sleep a night, but you're almost certainly not one of them. There are some people who can do that, but they're vanishingly rare. They are vanishingly rare. You need more sleep than 4 hours. In general, it's best not to be too rigid about sleep. I mean, you get enough sleep if you sleep enough that you are refreshed and can function. But really, you do need sleep. Sleep is so associated with mood and with low mood. There's even some evidence that it's associated with, what we call psychotic symptoms, so you really, and by that I mean, this is the sort of stranger ideas that people have that they can develop when they're very worried about things. So what I'd say is that I wouldn't try to get by on 4 hours sleep because it probably won't work. Best to get your sleep.
That's sound advice. Sleep is good. Another question. I think you've touched on this now, but I just will ask it because it has a slightly different tact. How do you balance stress and workload? And the person who's asked this question has said, the more anxious I am, the less productive I am. And in turn, it massively impacts on my mood.
Okay, well, this is not an uncommon thing. This is not an uncommon thing. I don't mean to diminish your own experience of it, but this is often what people find. And often people who get into medical school are quite perfectionist. And it can be a bit of a vicious cycle in that you're not doing things perfection, so you get anxious and that makes your focus worse, and it all sort of spirals a bit out of control. One very simple way for dealing with worries, and it's going to sound a bit strange, but this is a technique which is used in some of the talking therapies I mentioned, is to set aside a time to worry about things. So to set aside a time, if you're worrying about something, write it down and say, I'm going to deal with that at 4:30 or whenever I have my specific time for worrying about it, and just move on as best you can. Now, it's like anything. It's not very easy to start doing, but once you start doing it, it gets easier and easier. And what you're trying to do there is to compartmentalize your worries. So you're setting aside time to think about them, but you're not letting them just run through your head the whole time in a vicious cycle. So that's just one very simple thing you can do. If you find that you really are getting anxious about things, that it's getting in the way of things, then that's a really good candidate for cognitive behavioral therapy or a talking therapy. They can be very, very good at figuring out the sorts of unhelpful behaviors, the unhelpful automatic thoughts which arise, the unhelpful actions, and figuring out the links that you can break those particular vicious cycles. So there are some books you can read on the subject. One book which patients of mine found very helpful was by a doctor called Anthony Hope, and it was called How to Manage Your Mind, which I think is published by Oxford University Press. There's various other materials online, or indeed therapists who can just help you very practically to address this issue.
Thank you, Niall. We've got another question here about suggesting some ways for medical students and medical professionals to relax after a difficult day at work. Now, I think, that kind of touches on some of the things that you talked about earlier about looking after yourself physically, to look after yourself mentally.
Yes, well, the most important thing is to try to leave work at work, and to basically finish your jobs, figure out how you get out of the hospital, and leave it and put it behind you and really compartmentalize things. Once your shift is over, that's it. That's easier said than done. One of the things which can help is to take up some other sort of activity which is distracting. So if you take part in a team sport or something like that, those can be pretty good for your mental health. to actually set aside routines of relaxation. Very important to have a wind down routine at night, so you're not going to bed worrying about everything which happened during the day and which you have to do the next day. The other thing, there are two other things I'm going to mention, one of which is that the junior doctor experience or the medical student experience, a lot of people report feeling breathless, like they run off their feet the whole time. Sometimes it helps to just get up earlier in the morning. So you have some time to, to organize yourself and you don't feel like you're on the go the whole time. The other thing is that you can seek support from your peers. There are such things as Balint groups, which if you might have one in your organization, you might have one in your hospital or in your medical school, where you and your fellow medical students or your fellow doctors can reflect on the experiences that you've had with your peers in a very safe, contained setting. And that can actually help to take that anxiety and that stress to realize that other people have these experiences too, and to contain it within the work setting rather than being something which you're always taking home.
Mm. Yeah, I think that is really again good advice. It's difficult for some people right now who are working at home, but then I guess you can move away from the place that you're working potentially. I've got another question about sleep, and it may be touching on what we've covered already. I sleep for 3 hours in the evening as I get pretty tired after long hours of class at medical school, then 3 to 4 hours in the late night. Will this routine affect my health?
Well, it sort of depends how long you've been doing it for. People have all sorts of idiosyncratic sleep patterns, and I'd need to sort of know a little bit more to see where you sit in that. In general, people seem to do best with this sort of consolidated block of sleep at night. And there are various aspects of sleep hygiene which you can do which help to get yourself into that cycle. So you can probably go to, I think the NHS website again has some advice on this, but it is to do with things like having wind down routines, not drinking caffeine after a certain hour, making sure that your bedroom is relatively cool, that you don't have your phone next to you, don't have your laptop next to you, that you very self-consciously make sure that your bedroom is the room you sleep in. And trying to get that block of consolidated sleep. Of course, people wake up a bit during the night, but by and large, people seem to do best that way. Of course, you might be the exception to that. So this is, I'd need to know a bit more about you personally to give that advice, but it's probably worth looking up online sleep hygiene resources and just to see if there's any ideas in there which you might find helpful.
Thank you, Niall. I have a couple of questions here, and I think that you have covered this, but I just want to acknowledge that the questions have come in, just in case there's anything more you want to add. Someone has said, thank you so much for this subject area. I have a friend whose character has changed after their first year, so I want to know how I can counsel them, I think is what this person is asking. And then another question, what's the right thing to say to a friend who's feeling low and doesn't sound fake?
Okay, I mean, I think the first thing to say is that while you can offer support to people and you can maybe signpost them in some of the directions which we've mentioned in this session, you shouldn't feel that it's your sole responsibility to shoulder this burden entirely on your own. I think you can have a role in peer support, you can have a role in helping people to talk about their feelings and to putting them in the right direction, but that doesn't mean that this is entirely on you. That there are professional organizations which are there to provide that. So that's the first thing to say. As I mentioned earlier, the best way to start these conversations is to be very open questions, very non-judgmental questions, to ask if everything's okay. Sometimes, reflecting on how someone seems to you. So instead of saying you're very down, saying, oh, it just seems to me that you've been a bit quiet. Is everything okay? And making sure that what's being communicated is not that you're judging them, not that you're holding them to some standard, but just that, you've noticed that there's something that's a bit different and you're wondering if you might be able to help. As people open up, as the great psychoanalyst Anthony Storr said, don't just do something, stand there. Don't feel you have to immediately jump in with solutions. Very often just allowing someone to talk, very gently asking them more questions, you know, when I've read that when people experience this, sometimes that happens. Is this something which you think might be happening in your case? You know, that kind of thing.
Mm-hmm.
And then at the end, I think it's always important to just signpost people to say, well, look, maybe it's a good idea if you talk to someone else about this. Sometimes you can offer even to go to someone's first appointment with them, or just to talk to them before or after. And that can be a very supportive thing to do. But I think it's very possible to be supportive to someone, but without feeling that everything rests on you, because I don't think that that's a healthy thing either.
Mm-hmm. Thank you, Niall. We are kind of at time, but are you okay just to take a couple more
Yeah,
questions?
I can hang around for a bit.
Great. So we've got quite a few coming in. I've got a couple about treatment, actually.
Okay.
One question, what is the best way to deal with OCD and anxiety? I know that you have talked about some treatments already.
Yeah. In general, with OCD, I mean, that's a slightly different thing to anxiety. Well, in that most of the time, anxiety would be the sort of free-floating sort of anxiousness and awful feelings, and the feeling of palpitations and these physical symptoms. OCD is a bit more focused on specific actions and rituals which are used to sort of control feelings, unpleasant feelings. Both these things respond pretty well to psychological therapies. So, as I mentioned with CBT, and I've realized I haven't really gone in, I've mentioned breaking patterns of behavior, but I haven't really mentioned how that would work. So I'll give you a quick example, if I may. So, for instance, the example I always use of how CBT works is if I'm walking along the street and I were to see you, Deborah, and I were to wave at you and you weren't to wave back at me. If I'm in a sort of an anxious and depressed frame of mind, I'd think, well, that's because I've insulted Deborah horribly in some way. She doesn't like me anymore. I'm totally socially inept. And I'd go home and worry and ruminate over that. Now, if I then saw my CBT therapist, they would say, well, it's possible that Deborah didn't notice you. It's possible that it was Deborah's doppelganger. It's possible that Deborah has some worries of her own going on. So instead of going home and ruminating and worrying about it, maybe you should give her a call and say, hey, I spotted you in the street earlier, waved you, but you seemed a bit preoccupied. Is everything okay? And then, even if you have horribly insulted her, she'll appreciate the gesture. And so you'll get out of this negative, ruminative frame of mind and into a more positive one where you're taking action, you're breaking those automatic thoughts, and you're preventing going into these negative spirals. So that is the model for how CBT works. So you can imagine how that might then apply to situations which cause you anxiety.
Mm-hmm.
You can imagine how that might apply to things like OCD, with very gradually changing your behavior so that these ritualistic behaviors are broken. So that's very good. There's also some evidence that medication, such as antidepressant medication, can work. I don't quite have the time to go into the ins and outs of how exactly antidepressants work. We did publish a paper in the Lancet Psychiatry called How Do Antidepressants Work? And I'll just pop the link there in the chat
That
in
would be
case
great. Thank you.
anyone's interested in reading that. It's been a very popular article. There we go.
There's a question here, Niall, about a specific drug. I will ask it, but
Okay.
I understand if you, if it's not something that you can answer or want to answer.
That's
Can
fine.
the drug olanzapine be used in depression?
Well, olanzapine is an antipsychotic drug, so it works in a different way to antidepressants. It works by blocking a receptor in the brain called the D2 receptor. Now, there is a bit of work on augmenting antidepressants with antipsychotics, but the science of that is not fantastic. I'd say that this is a more exploratory use of the drug, and it's it's something which I think is it is a terrible phrase. More research is needed. I wouldn't completely rule it out, but neither would I say that it's it's got as much evidence behind it as, say, the use of psychological therapies or the use of antidepressants or the use of mood stabilizers. So it's a topic which I think is has less of an evidence base, as a much more experimental mode of treatment.
Mm-hmm. Okay, thank you. And just to kind of bring things to a close, we have had a few questions from people about themselves, which I won't read out in full, but for anyone struggling at the moment, Niall, or not really feeling themselves, or feeling that that they're not not feeling themselves, could you maybe just reiterate the advice that you gave earlier about the who to speak to and lines available?
Okay, well, there's many sources of help available. So the first thing is that, as I mentioned, there are listening helplines such as Samaritans and Lifeline. If you Google them, they'll come up. We've also got a slide with those numbers on, which we'll show you in a moment. You can also go to your local university mental health service or your general practitioner. You can also, if you're in England, refer yourself to the psychological therapies people at IAPT. So there are lots of ways in which you can get help. If it really is an emergency, then you can go to the emergency room where they should have a liaison psychiatrist. But the fact is that there really is a lot of help available, and I know it's not easy asking for help, but I think often people who find that medicine can be a struggle sometimes, the course can be very difficult, the job can be very difficult, that often they're surprised to find how many of their peers are also in the same situation as them, are also having difficulties. And so I think if we're all a bit more open about it and support each other, I think things could be a lot better. So thank you very much for sharing your experiences.
Thank you. Now, maybe I could just ask you one more question, and it's just related to what you've just mentioned. It's really about, what are your thoughts on the discussion around mental health? Do you think that the stigma is lifting at all?
It isn't. And oddly enough, I think that it is and it isn't. Strangely, I think a lot of the stigma still exists within the medical profession. I think there's the equation of mental health problems with somehow weakness in some way, which is of course totally untrue. But I think the doctors can be harder on themselves about their own mental health than they'd ever be about a patient. It's a strange situation. So I think that it's like William Gibson said about the future. It's here, it's just not evenly distributed. And I think that there is a sort of post-stigma mental health world that's kind of here, but it's just not evenly distributed. And it could be more evenly distributed, in my view, within the medical profession itself.
Yeah, well, that's a really interesting point to end on. And I really would just like to say thank you ever so much, Niall, for your time today. It's really appreciated. This is a very, very important subject, and I know it can be a sensitive subject. So thank you to everyone on the line as well. And thank you to those of you who asked questions. And I hope if those of you who did ask questions about things that are personal to you, I hope that you can take something from what Niall has said today and take some action. Just want to there we go. Sorry, I couldn't get my computer to work. These are some of the numbers that have already been mentioned today. And yes, thanks again, Niall, for your wisdom. Apologies to anyone whose questions we didn't get to. There were quite a few. Some of them were very similar, so if I didn't read them all out, that will be the reason why. But we will look at them again and maybe follow up with Niall if there are a group of similar questions. So I just wanted to say again, thank you very much. All the best to everyone, and thank you for joining us.
Thank you. Bye-bye.
Thank you.